We always talk about Palantir being so ingenious with their actual software, and they truly are. But Palantir is also genius in the way they run their company. Specifically, over the last year or so, they really have been stepping their game up. A little bit over a year ago, they hired Dr. Indra Joshi as part of the Palantir team, and she's head of digital transformation AI for health. As per Dr. Alex Karp, they're not so big in Palantir with names and titles. But Indra Joshi is an extremely vital part of this entire Palantir system. Healthcare is the third largest vertical for Palantir, said so by Shyam Sankar, the number 2 at Palantir, right behind Dr. Alex Karp. Healthcare is a major contributor to the bottom line when it comes to Palantir, and Palantir works across a wide range of healthcare, be private, public, hybrid, and anything in between. With the AI revolution right on our door, Palantir is making sure to get ahead of everybody else. I'm going to make a video about this AI revolution when it comes to Palantir next week. But right now, I wanted to really focus on Palantir's business savvy. As we all know, Palantir is trying to get this massive $1 billion contract, in my opinion and many opinion, but at the very least, several $100 million contract with the NHS. They hired Dr. Indra Joshi, and guess what? She worked for the NHS for about 2.5 years. And before working for the NHS, she worked for the WHO, which stands for the World Health Organization. And before that, she worked at the NHS as well. But what did she do at the NHS? Specifically, her title was Head of AI Transformation. Palantir takes her over. She now works for Palantir, and she's actually super charismatic. She obviously has a lot of connections when it comes to the public healthcare center. She obviously has a lot of connections and can open up many doors for Palantir. And around 2 weeks ago, Dr. Joshi did a presentation where she spoke about Palantir and Palantir in the health sector, and she actually gave a lot of great examples. This is around a 15-minute video. This video was originally published by Wired. The thing is, this video only has around 250 views. Believe that? 250 views. So I want to make sure that everybody in our Palantir community, whether you are in the Palantir community, thinking about being in the Palantir community, or maybe you want out of the Palantir community, at the end of the day, this is still America, and this is up to you. But I want you guys to get the raw data. And I love to show you guys clips and presentations of people speaking besides for just Dr. Alex Karp. I want you to see, upper middle management or lower higher management, if that makes sense. I want to see people part of the team talking about Palantir and presenting Palantir to you. But before we do that, please in the comments down below, let me know, are you more bullish today about Palantir now that they announced the new AIP, Artificial Intelligence Platform, which I have a banger of a video about next week for you. Basically, it's ChatGPT on steroids. Specifically, you can build a ChatGPT model for your specific business with your specific data needs. Of course, everything is encrypted and secured as per Palantir's motto. Guys, let me know in the comments down below. I'm super excited about this new product. I have a video coming out on this next week. Enjoy the rest of this video. And I just wanted to say happy Passover to my Jewish brothers. I want to say happy Easter Sunday to my Christian brothers. And I wanted to say Ramadan Kareem to my Muslim brothers. Brothers and sisters, let's all try to get along. This world is absolutely going to shit, and we need to be kind to each other. So happy holidays and enjoy your loved ones. Let's get into this.
Great, thank you. I'm very conscious that we've all been sitting for about an hour and a half. So as sitting is the new smoking, could I encourage everybody maybe just to stand up? We are at a health conference, thank you. Yeah, like jiggle wiggle, move your arms. I don't know about you, but I've got a really bad crick in my neck. And listening to all these stories about, genetic testing, how we can improve screening, women's health, I feel like I've now got 98 things wrong with me that I probably didn't have when I walked in here this morning. So I hope everybody feels a little bit jiggle wiggle. We've only got 20 more minutes before coffee. And yeah, like sit down whenever you feel comfortable. Don't stand, sit. So, as Greg has very kindly said, my name's Indra. I'm a doctor by background in emergency medicine, and I joined Palantir Technologies about a year ago. For those of you who aren't aware of what we do, some of you may have heard about the COVID vaccination program. We're a software company. The vaccination program was built on our software. And what I want to do today is just give you a brief overview of some of the work that we've done to really accelerate research into long COVID. So this is not just a story about software and data. We've heard a lot about data, and data can be quite cool. I personally find data really, really exciting. I've heard all of the speakers today talk about data, and that really, I'm going, wow, this is so exciting. Let's talk more about data. So I'm just going to talk a little bit about some of the boring aspects of data. I don't have a whizzy, cool technology to show you, but I do want to show you about how when you get the fundamentals right, you can really accelerate both research, but also findings that many of us have come across. So let's just talk a little bit about long COVID. Many of us in this room may have had a COVID test. We may have had symptoms of COVID, may have been diagnosed with it. But unfortunately, a number of us still are suffering from those symptoms of long COVID. So this year, in January, ONS reported a survey, and approximately 2 million people are still experiencing symptoms of long COVID. And normally, the infection, as we all know, if we've had it, you usually recover after a few weeks, but some of us continue to have it. And across all age groups, so this includes children, you see around 10 to 20% of people are still suffering from those symptoms. And the diagram on the right here shows that there's a huge range of symptoms that are really there. And when you have something that's novel and unknown, how do you start understanding what is that disease? How do we better research it? How do we better understand not just how to diagnose it, but how to better manage it? And actually, this is a real problem, not just here in the UK, but across Europe and globally. Earlier this year, The Lancet, they did a review on the number of people who have been diagnosed with long COVID, and around 65 million globally, and that's just an estimate because it's so hard to diagnose, are still struggling with the effects of long COVID. And what does that mean? That actually means, you have this huge conglomerate of symptoms that you're suffering with, but then that affects your mental health, it affects your well-being, it has an impact on the economy. And earlier this year, the WHO in Europe said, we've really got to try and focus a bit more on this. We've got to encourage policymakers, governments to actually focus and put some more effort and money into understanding these effects. So what I'm going to talk about a little bit is just reversing a few years in time, back to sort of pre-pandemic time. And for those of you who aren't aware, in the US, the National Institutes of Health, they have a program called NCATS, which, let me get the acronym right, is the National Center for Advancing Translational Science. So they wanted to set what you call a collaborative analytics environment. And the diagram's illustrated up there. And what this was very much to improve research across many different areas, but also, as I said, ensure collaborative analytics. So what do we mean by collaborative analytics? Well, quite often in research, it's quite a competitive environment. We've heard from some academics, we've seen lots of studies being talked about, and so often it's about the first author or the person who's led that research program. But actually, there's often a huge number of people involved in that. Those who go all the way from data collection to cleansing, harmonizing that data, to producing clinical trials, all the way to publication. And so by bringing together all those different diverse sets of groups, you start creating what we call collaborative analytics. And so there was a grant. The team won this grant to set up this collaborative analytics environment, but they really struggled in trying to get those data sources together. And even though they struggled, they managed to do it. They did it on our Foundry platform. And then this is really just to talk a little bit about the challenges of actually, when you've got something, how do you understand what is good for discovery? So we've quite often, we've had a lot of speakers here today talk about different conditions. We've had a great speaker talk about genetic testing as well, and kind of looking at screening. So when you want to do things like this, you actually need a huge amount of information to look at patterns and understand what is happening in those areas. And so this is just a very kind of brief overview of the benefits of both what we call a federated and centralized approach. And when you're trying to do centralized discovery, the centralized approach is far better. So when you're challenged with a condition that you know very little about, so we go back to long COVID, you need to understand how to bring that data in. And what this slide is trying to show you is actually data quality, which isn't something we speak often about. We quite often talk about data, and then we talk about the end result of what that data has done. But actually, for those of us in the room who've had to manipulate or harmonize data, you know what the challenges are. So for some of us, so for example, if I say I've ordered a head CT, is that the same as saying I've ordered a brain CT? Are they the same thing? When you're coding, actually, that's vitally important. And then when you're trying to do discoveries, actually having a common language, a common methodology is also very important. So this centralized analytics approach allows you to harmonize that data quality and not only understand where the differences are, but also create what we call a feedback mechanism. So you start helping people who are capturing that information, capture it in the same way, and therefore you can understand more about these different conditions. And so this slide just shows the different effects that we've had on those data qualities. And really, this is saying, how do we then, so why do we care about data harmonization? I've been banging on a little bit about data quality, but why care about it? Because when you're looking at something that you don't understand or you don't have much information on already, so for example, the COVID condition, understanding that you can compare like for like is vitally important. So being able to compare apples with apples, being able to understand, okay, you're using oxygen at this particular level, and I'm comparing that all the way across the country on another hospital and another patient in the same setting. And so being able to compare information across many different settings is really important. And so this is why we quite often want to make sure that we can have data harmonization and ensure that those people looking at the information on it can do really cool stuff. And how is this also important? So quite often we talk about building models, building algorithms. When you've got a platform that allows you to understand the end-to-end of that data journey, when you build your models, when you build your algorithms and you make tweaks on them, you can understand and it can be fed back to where that data came from. So this is why we like to quite often focus a little bit more on data harmonization and ensuring harmonization. So the N3 data enclave came out the start of the pandemic. So whilst NCATS was very keen to look at various different pathology areas and encourage that collaborative analytics, at the beginning of the pandemic, they actually had to focus down and say, okay, we need to start looking at this particular condition. And the previous speaker spoke about the US, it's a private payer system, very disjointed, lots of different hospitals all working in silos. And actually, if you're a government or you're a system, how do you really start impacting policy decision and understanding what's best for the nation when you've got all these different pockets? And so the NCAT set up this N3, National COVID Cohort Collaborative, which is still going today. You can see the impact it's made. And around 7 million cases. So if you're diagnosed with COVID, you've got a COVID diagnosis proven through a laboratory test, your information is then transmitted into this data enclave. And what it has allowed is researchers just to start asking questions on that information. And by harmonizing all that information, it's really encouraged people to understand, what are these symptoms of long COVID? We've talked about it a little bit in the literature, but we're not sure because we're still tracking these patients through time. What treatments are actually affecting these people when we're giving it to them? What are the outcomes of those treatments and how are we tracking those over time? And actually by collating that information, by allowing lots of different research groups to work on that information, you then enable much more research to be done and much more to be published and learned. And so The N3 represents one of the largest secure collections of harmonized clinical health data in the US. And the power of this is not just about that information and the depth of that information, but it's about the diversity of teams working together. So one of the speakers earlier spoke today around every user in the healthcare system has lots of different needs, from patients to policymakers to people who design apps and digital health tools, all the way to those who evaluate it. And when you start bringing those different diverse teams together, what you end up happening is far more valuable outputs being delivered. And here's just a snapshot of some of the research that's been published on the back of this N3 data enclave. Some of this is in preprint, some of this is still coming out. But really what I want to draw attention to is that, yes, there's been a huge amount of studies, lots of publications. We've now learned a lot more about the SARS virus than we had before, but also about bringing those different teams together. And so often we like to talk about, the first author or the person who's been in charge of the research. And that's cool, that's sexy, you're the person who's published the information. But actually there's a huge amount of work that goes underneath, and we call those attributions. And what this platform's really allowed is anybody who's attributed to that data to be recognized, to be seen and to be heard, and to be brought into the limelight as well. And so Dr. Melissa Handel, who oversees this program, was telling me the other day, actually they published one paper and they had over 300 contributors. And it took the journal a good 8 months to go through all of those contributors. Now, this is something that's really different. That doesn't normally happen in research. Normally you have a small team who are involved. And so that's what I'd just really like to highlight, that this isn't just about the data, about bringing it together, but also about transforming the way we do research, about making it far more collaborative, but also highlighting that, it can be for anyone. We talked about, at the beginning, I talked about the different symptoms of COVID. And actually here is one of the studies that was published a couple of years ago around looking at how, on the back of the information from the N3 platform, how do you actually recognize long COVID in children? And then this one is about how do you inform policy? So what about those treatments? How do you know where to send vaccinations? And this I just want to end on is really about, it's so easy to talk about technology. People love talking about technology and what it does and all the cool things. But actually transforming culture is really hard. And for those of us in the room who've, had to implement policy decisions or had to try and implement technology, that's almost that easy bit. It's transforming the culture and changing the way technology is used in the workplace or in a particular way has really can transform the pathway. And so this slide, the N3 team, they won an award. And I wanted to, just highlight 106 teams. That's really bringing together a huge amount of diverse groups and also across 26 different countries. So again, this is about bringing people together to be able to work on a common problem and to solve it in a way that hasn't been solved before. And just to end, conscious of time, it's still coming out, so maybe I don't know if I'm going to break anything, but the team have also got a publication coming out, not a publication, an article coming out in Teen Vogue, which I think is really inspirational. So we've had lots about women's health and about inspiring the new generation and how about education and understanding. And if we want to get more children and more girls involved in these quite technical subjects, we've got to inspire them. And actually, they've got a great article coming out in Teen Vogue, which just talks about how if you do collaborative analytics in a very diverse way, it can be quite cool and quite exciting. So thank you.